Hello and welcome in to episode 12 of the DAV Podcast. I'm Dan Klaskins along with Ashley Burns, and today we're getting into a very important topic here, ending sexual harassment at the VA, talking about that new White Ribbon VA initiative. And Ashley, as we know through all of our work here at DAV with women veterans and what we've done in this space, this is definitely a big issue in the fight for equal rights.
Yeah, absolutely. I mean, we've talked a lot about this. It's become a really prevalent topic lately. And, there have been spikes across the VA facilities where we're hearing more and more about sexual harassment, and the numbers have gone up. And we know this is an issue that we have to tackle, and that respect is really the bottom line. And so that's what we're going to talk about here today.
Yeah, we're really looking forward to diving into this. If you've missed any of our previous podcasts, we invite you to check those out. You can get them anytime, dav.org/podcast. You can also subscribe wherever you listen, whether it's iTunes or Google Play, Stitcher, Spotify. Check that out as well. And DAV, if you're not familiar, you're new to the organization, we help over 1 million veterans every single year in life-changing ways through our programs and services. You can learn more about getting help or donate to help us help veterans at DAV.org. And I know, Ashley, legislatively and what we do from the advocacy side is very important in all of this. And as I mentioned before, women veterans is a very DAV's sort of front runners at fighting for these rights. And we get into this episode today, we've got some fantastic guests on this issue particularly.
Yeah, absolutely. And I'll talk about our guest here in a moment. And it really is, there's a lot of legislation, as you mentioned, that's kind of in the works right now. We'll see what happens before the end of the year. Some of that makes a push. It would be really nice to see some of that make its way through before we head into a new Congress. But, I know we've mentioned it on the show before, but 1 in 4 women veterans who use the Department of Veterans Affairs healthcare report having experienced some form of sexual harassment at VA facilities. So that's peer-to-peer, veteran to veteran. Our own Mary Deaver, Air Force veteran Mary Deaver, was joined by Lelia Jackson, who's a 20-year Marine Corps veteran and a senior strategist in the Veterans Health Administration's Office of the Chief of Staff, to tell us a little bit about White Ribbon VA, which is a campaign that ran throughout the month of October, focused on ending sexual harassment, sexual assault, and domestic violence in VA healthcare settings, and in the VA community as a way to promote positive change to that culture.
Hi everyone, I'm Mary with DAV, and I'm here today talking with Lelia Jackson with the VA about a very important campaign going on right now called VA White Ribbon Campaign. Ms. Jackson, can you tell me a little bit about what that campaign is about and why we should pay attention?
Well, first, I would like to just tell you where we got the idea of White Ribbon VA. White Ribbon VA was inspired by the international organization, White Ribbon International Campaign, and that organization has been around since 1991. Historically, they have focused on efforts related to men and boys not committing violence against women and girls. But for White Ribbon VA, we really focused on a genderless movement, really. White Ribbon VA is a genderless effort. Men, women, veterans, employees, and our larger community can participate. White Ribbon VA is really a national call to action under our VA Stand Up to Stop Harassment Now campaign. Our goal is to eliminate, get rid of, eradicate sexual harassment, sexual assault, and domestic violence in VA healthcare settings, and also in the greater community.
What is a message VA is working to share, and who does it apply to?
Well, I am a veteran. I've served 20 years in the Marine Corps. And I'm proud of my service. And so really, it begins with me. Respect really does start with each one of us. One of the aspects of White Ribbon VA that appeals to me is that everybody can participate. Often when you hear about awareness campaigns like Sexual Assault Awareness Month in April or National Domestic Violence Awareness Month in October, which we're in, people say things like, oh, that does not apply to me because I don't harass anyone, I don't assault anyone, I've never committed domestic violence. Well, just so you know, according to the Centers for Disease and Protection, the CDC, their stats are like 1 in 4 women and 1 in 10 men in the United States during their lifetime has experienced domestic violence. So what that says to me is that maybe I have not been a victim or have experienced domestic violence, but I probably know someone who has either been a victim or an experiencer of domestic violence or sexual assault, or I have experienced it myself. And also, there's a study, a VA study that says 25% of women veterans have experienced cat calls like, hey, baby, hey, sexy, hey, honey, hey, stud. Well, that's offensive. That's harassing. And that's part of our commitment with White Ribbon VA is to stamp out harassment, assault, and domestic violence. And so if 25% of women have experienced cat calls, if I'm not one who said those things, I may have experienced those things, and I can do something about it. I can either call them out and just say, hey, don't do that. We can report them to the police. We can do something about it. And really, that's really the goal.
It doesn't have to be much, but you hit the nail on the head when you say, even if it's just calling somebody out. If
yes.
you see something that, someone might not consider to be disrespectful or harassment for themselves, but you can see the action take place, then it is also our responsibilities to say something, to stand up for the person and to educate somebody, because even, with good intentions, it can still be harassment.
Yeah, it's very true. It's true. I mean, sometimes you don't want to say anything because you don't know quite what to say. And in those instances, just tell the police, tell the patient advocate, tell someone. And that's a part of our pledge, is to pledge to never commit, excuse, or remain silent about sexual harassment, domestic violence, and sexual assault. If you see something, you're not comfortable saying something, don't excuse it. Don't say, oh, it's because he's older. Oh, that's because she's younger and she's experiencing these things. No, it's wrong. And if your gut tells you it's wrong, then it's wrong. And you might not feel comfortable saying something, but say something to your doctor. Say something to the police. Say something. Our goal is to eliminate it in our facilities. We want everyone to feel safe and welcomed in VA healthcare settings, and not just VA healthcare settings. In our communities, in our when we go to a regional VA to do our benefits, we want people to feel welcome to go in and get their benefits. Any VA setting, our DEPSEC just put out a message about this very thing. She gets her care at VA healthcare, at VA medical centers, and she wants everyone to feel like they can go there and not feel harassed or worry about, glares or cat calls, but, everyone is welcome. You've all served. We've served, and we deserve to be able to go into a harassment-free healthcare system. Finally, I think in our communities, we want people to be safe in their communities, and we want people to know that they can get help from VA if they are victims of military sexual trauma or domestic violence. We have resources in VA that can help.
How can VSOs make a difference in ending sexual harassment?
You do so much, and we really appreciate that question. Thank you. I would love if you would talk with your veteran constituents, ask them to be accountable to self, show respect to others, take the pledge, join us in taking the pledge. The pledge is simple, please pledge to never commit, to never excuse, and to never remain silent about sexual harassment, sexual assault, and domestic violence. Oh, another thing that we would love for the VSOs to do is retweet. We've been tweeting this month. We'd love if you would retweet some of our messages, because we want everyone to see what this is all about. It's not just a VA thing, it's a veteran thing. We're very thoughtful in creating a pledge that resonates with our veterans and with our employees. So we really hope that our veteran population and our employees will participate in the White Ribbon VA campaign.
What resources are available to veterans who have experienced harassment, or who can they reach out to for help? Because like you said, maybe we might not feel like speaking up on someone else's behalf, but even more so, we might not feel like speaking up on our own behalf. So
Thank
what
you.
can people do? Where can they go?
Thank you. Thank you so much for asking that question. That is really one of the primary things that we want to offer up during this campaign. We want to tell people about the resources that we have in VA. So, of course, we have the Intimate Partner Violence Assistance Program, IPV. You can Google VA IPV, and we have a whole host of resources on that page. It's the Intimate Partner Violence Assistance Program. We also have help for those who are military sexual trauma survivors. If you don't remember all of those places, talk to your Women Veterans Program Manager, talk with the patient advocate, talk to your provider. They will get you to these resources. These resources are here for you, and we want you to be able to use them.
I'll also plug for DAV as well. We also have a resource page with a lot of these that link right back to the VA resources. So if you can't find this, or if you can't remember exactly where to go, there's a lot of ways to get to the same goal. So make sure, like Ms. Jackson said, check with your own provider, check with the Women's Veterans Center, and then also, DAV.org. We have resource pages. And because this isn't just a woman veteran issue, this is an all veteran issue.
Yes.
And so these resources are there, and they're plentiful, and they're available. So what would you say maybe to a veteran, male or female, who has experienced harassment and maybe decided not to return to VA because of that? Would you suggest that they try it again, give it another chance?
Absolutely. I'm hoping that was an anomaly, that was a bad day, that they went in and they experienced that. We have really stepped up our efforts to end harassment and assault. We are educating employees to be more vigilant when they see things that's not right. We're asking them to do something about it, to stop it in its tracks. We have training that's going on now for our staff, so they know that it's not appropriate if a person calls someone honey. Women veterans, don't like it. Some women veterans have said, "Don't call me honey," and there are some male veterans who've been called stud. So we're saying cat calls are just not, it's not appropriate. Of course, any type of touch that's not appropriate, sexual assault or anything like that, that would not be tolerated in our campuses. And we've talked with the VA police, and they know, and they will root it out. So we want people to give us another chance. We have a great team of leaders at VA who care deeply about this topic. I care very deeply about this topic. I've been in this job for about a year now, and we've been working very hard to change the culture.
Is there anything else that you would like to add?
Just one more thing. I would like to ask one more time if you and your audience would please consider joining us in our pledge to never commit, excuse, or remain silent. And I would really love to read our pledge, Mary. Is that possible?
Please do.
Okay. Our pledge is, and I'll just read it. I pledge from this day forward to never commit, excuse, or stay silent about sexual harassment, sexual assault, or domestic violence against others. Therefore, I promise to honor VA healthcare settings as a safe and welcoming environment, recognizing that touching or comments may make others feel uncomfortable, like commenting on appearance or calling others baby, honey, sweetie, stud, sexy. Talk to others in my life about the repercussions of unwanted hugging, touching, or flirting. Give everyone their extra personal space. Understand that some veterans and others may have invisible wounds and experiences that I may not fully understand. Lead by example through my thoughts, words, and actions. Remember, everyone deserves respect.
Where can I find that pledge online?
We have it on our website, www.va.gov/health, HELTH/harassment-free.
Well, we're thankful you took the time out to talk about this very important initiative, and we will absolutely get the message out in every avenue we can. So thank you.
Thank you.
That was obviously a very great interview there by Mary, talking with Layla around all of this. And so much of what she talks about are these seemingly innocuous moments where maybe someone makes an offhand remark or it's actually offensive to the attended party. These days, moments matter. and it's something we all can work to change. Ashley had a great chance to speak with DAV member and Army combat veteran Raisha Clark of Arkansas. She's a mental health counselor and a VA healthcare user who's had her own experiences like these and is sharing her thoughts with us today.
So can you tell me, Raisha, a little bit about your military service? When did you serve? What did you do in service and when you got out?
Yeah, sure. So I joined the Army when I was 19. I'd gone to college for about a year and a half and quickly realized that I was not focused or motivated at the time to go to college. It was just going to be an active duty stint of 3 years. And that was in 2000, and it ended up being 10 years, which was amazing.
So you got out then in, I'm sorry, what year?
2010.
Did you immediately start utilizing VA services? Was there a gap in time? You know, how familiar are you with utilizing VA for your healthcare services?
I had an exit briefing with a VA facilitator, which was informative, but I think like most veterans, I didn't quite know what to do, what the process looked like. Even though I had the briefing, I still didn't really know what the process looked like. And I'm so grateful that the city that I moved back to had a regional office and a VA hospital right there in that city. So I was really able to get my services started getting VA healthcare fairly soon, within a year after getting out of the Army. So unlike some people that, it's years before they are able to get time into services, it only took about a year for me.
I know that experiences vary very widely across VA. My experience here in DC is not going to be what your experience is in Little Rock, which, it's good in some ways, it's bad in some ways. I mean, it should be a little bit more even, I think, and in a lot of the ways that especially when we talk about like specific, gender specific services, I really would love to see there be parity across all facilities, but we're working towards that. But the overall patient experience, especially when you are a woman veteran, you're coming into the VA, we know that 1 in 4 women have experienced some form of sexual harassment at a VA facility, and that can take on a number of different types. It's not just
Sure.
the things that we think of. So can you tell me a little bit about the experiences that you've had?
Yeah, I think you bring up a good point that it's not just what we would assume harassment would look like. I do have some very classic examples, catcalling, veterans waiting to have the DAV van come pick them up, or just walking up and down the hallways. It's fairly male dominant. So the patients that are receiving cares typically are older men. And so, you're a young woman coming in there and it's old-fashioned cat calls or, hey, little woman, what are you doing in here? Things of that nature. And then things that I would consider harassment, such as asking for certain labs that are unique to women. When we're not able to get our providers to hop on board to say, yeah, this is a woman-specific issue, you might only see, the bulk of your clientele may only be male veterans, but, as a woman veteran, I feel displaced when I feel as though you're questioning why I want to have women-specific labs drawn. It feels very uncomfortable. So, it can be anything from, having people whistle or, say sweet nothings, so they think to you, to providers and their clinicians, once you get in there, just really making you feel uncomfortable trying to advocate for yourself.
You say the word uncomfortable, and I think many of us have experienced that at some point or another. And I think it comes down to another word, and I would say it's about respect. Can you tell me how that makes you feel? If you walk in and you experience a situation like that, does it make you feel as respected as a male counterpart who doesn't get those same questions or doesn't get that same experience?
I don't know what the male experience is, but I tell you, if it's what I felt going into the VA, it would be really bad. It starts when we pull up to the parking lot and we attempt to park in a purple heart spot, and we have a purple heart, even if our license plate doesn't say it. And someone telling us, well, you're a woman, that can't be you, that's not your experience, quit being lazy, go take your bleed, to the other side of the parking lot. And it's like, well, you haven't even given me a chance yet. And I wonder, do men have to, when they get out of their vehicles and they don't have a Purple Heart license plate, do they have to explain to someone who's walking by that they have a right to park there?
What would you say to fellow veterans about how we treat each other?
I want my male veteran counterparts to remember that they've served right alongside women throughout their career, whether it was just a field exercise, whether it was, a whole duty station. Remember the women that were there with you in a variety of ways. Remember you respected them then because you had to, because it was the right thing to do. Remember that feeling that made you respect women then. Do that now. Do that now. Honor us the same way you did while we were active duty serving with you. Now that we're out of the military, now that we're doing our own thing, experiencing life as a civilian, give us that same respect.
I couldn't have put that better myself. Is there anything else that you want to add before we close out?
I want to say how grateful I am for the VA services that I receive. And that's not everyone's story. But when I look at the crisis that's going on in our country now and see just how quickly medical bills can add up, yes, I think it's a benefit that all veterans should have. And no, not all veterans utilize it. But I can speak for me and say I'm so grateful to be able to have comprehensive health care. There's room for improvement, but that's any healthcare facility. I just know that I'm super duper grateful. I'm grateful for what you're doing. I'm grateful for people wanting to look at some of the issues and work towards building a better healthcare system for all of us.
Dan, DAV has been really an outspoken leader in the fight against sexual harassment at VA facilities, both externally and internally when we're speaking to our own members and our own audiences. And taking a cue from DAV National Commander Butch Whitehead, who, as I mentioned, has addressed this issue on social media a number of times, Mary Deaver returns speaking with DAV Human Resources Director and Marine Corps veteran Cody Van Boxel about how DAV is using the White Ribbon campaign as a means of helping all of us really reinforce that messaging about respect and making sure that if we see something inappropriate, we're reporting it, not letting anything just pass by because we feel like it might not matter. It probably matters to someone. So taking that messaging, reinforcing it with veterans who, of course, are the ones out in VA facilities using healthcare every day.
Hi, I'm Mary with DAV, and I'm talking today with Cody Van Boxel, DAV's National HR Director. Cody, we're talking today because a lot of focus has been VA's White Ribbon campaign is going on now, and that campaign focuses on eliminating sexual assault and harassment at VA facilities. How that applies to us is a lot of us use VA facilities, a lot of us know people who use VA facilities, and really it's an awareness campaign to ensure everybody feels comfortable when they go to these services that they've earned. And so from your perspective as the Director of HR, how is this important, and what can we each do to ensure that everyone feels comfortable?
Sure, and thank you for having me today, Mary. I'll tell you what, this is such an important issue at this time. We can go back 10 years, we can go back 20 years, we can go back 40 years, and, times have changed, and there has been a lot of forward momentum. A lot of good things have occurred, and there's room for improvement. It's the onus is on all of us to promote a positive environment for our fellow veterans. And, the VA, I think, has done a good job. We shared a video your team was a part of course. And I think they did a great job representing some of those challenges that our veterans are facing. Primarily, that was geared toward VA medical centers. We have to work together and change this culture, change the attitude, change some of the comments, and make these environments safe and welcoming. We have veterans who've made tremendous sacrifices, and they are utilizing services that they have earned that they need. So for someone to go to one of these facilities, whether it be a VA medical center, whether it be a regional office, whether it be any center of care, feel uncomfortable, to feel unwelcome, to avoid going there is truly devastating to some folks trying to get the care they deserve. So we all need to take steps in the right direction. I encourage everyone to watch the video if they haven't. The VA did a great job of addressing some of those points.
What are we talking about whenever we talk about sexual harassment and culture?
Sure. Well, traditionally, and I think those of us that are veterans and have served, if we've served in recent decades, we've all sat through the sexual harassment training. Those that have worked in professional environments in the private sector, we've sat through this types of training. So we think of the traditional, the obvious inappropriate touching, the egregious and inappropriate comments. Sometimes we forget that culturally we have changed, and there's things that people may not recognize. And of all people, veterans should understand that sometimes there's visible wounds, there's experiences that we don't all fully understand. And there may be things that may seem innocent. There may be things that were okay 40 years ago that aren't okay today. An example of that is hugging. You don't know what someone's been through, and that may make them uncomfortable. Have a stranger give them a hug. I'm not a hugger myself. I will tell you, if I know somebody and I love them, I'll give them a hug, and that's fine. People have different thresholds, and we need to be sensitive to that. Another common one is comments, maybe not to the level of catcalls, although sadly that still exists. And mind you, this is not gender specific. However, we do recognize that female veterans are more likely to experience these types of things. But the catcalls, calling someone sweetie or honey or darling, those things aren't always well received today. And so it's important that we recognize that and we take personal ownership and responsibility and check ourselves if we're in the situation that, we feel someone is acting out that way, someone's saying things, commenting, touching someone or anything like that's inappropriate. It's our obligation to step in at that point.
Well, you really hit the nail on the head there as far as the peer-to-peer support and the personal responsibility. I know sometimes things might have good intentions, but to the recipient, they are unwelcome. So what can we all do as veterans, as supporters, as staff members, as employees? What can we all do to help with this forward trajectory, this change in culture?
So as I mentioned, we've been through the traditional training before, and I'll tell you, studies have shown that it's not overly effective, but there's new things that are, and they've looked at it and they've studied soldiers, they've studied service members, and I say soldiers because there were specifically some Army studies, as well as in the Air Force. And the Air Force recently implemented a program where it teaches people to step in, where peers can come in and pull someone aside and say, hey, that's not okay. And that's the difference maker. So there's times where maybe that's not going to work. Maybe you're in a public setting and you're at the VA and you're in a waiting room and you don't know either of the parties, but you hear something and maybe it's not horrendously egregious. Maybe it's not something that you got to throw your arms up and run over there and push somebody out of the way or something like that. But maybe someone just kind of needs to get with the program a little bit. And that's where you need to step up. And if it's not appropriate to say something to them, maybe you're not comfortable, maybe you don't want the confrontation, you step aside and you say something to the VA. When you get back there and you see your primary care, you mention it and say, hey, I noticed this interaction. When you leave, you stop at the front desk and say, hey, can I speak with someone in leadership? Can I speak to somebody in charge? I just want to share an experience I had, so that can be addressed. Now, individually in our personal lives, in our circles, that's a lot easier, right? We can talk to our group of friends, of family members, brothers, sisters, mothers, fathers, and we see that that's easy to address. And that's very important that we take those opportunities in front of those that we know and we love and we trust and who may be offended in the immediate, but we'll get over it. And we say, hey, you need to take a step back and think about what you just said or how you just interacted with that individual. Those are the changes that are going to make a difference. We can sit in front of PowerPoints all day long, but each one of us has to take that next step. We have to get outside of our comfort zone to make this a better environment for everybody.
Well, absolutely. And we can't reinforce enough that it's not a male or female issue. It is a human issue. And it's something that we should all take accountability for, responsibility for, and call out, when we see it. And like you said, we don't need to be causing scenes and throwing up our arms and, things like that. But definitely don't just let it slide like it has in the past. What advice would you have for people who might not be clear on what they should or should not do, or should not say either?
Yeah, well, I think that one, it goes back to a typical rule, right? If you're not sure, don't do it. And that's probably going to be the thing. But we all have trusted people that we can chat with and we can have a conversation with. If you're in question, if you're not sure, it's probably not the right thing, I think is probably a good general rule. But don't be afraid to communicate with those you trust. There are great resources at the VA. There are folks who are happy to speak with you. There are social workers. There are veterans program managers who focus on women specifically at VA medical centers. Even regional offices have women veteran coordinators, and maybe their more primary mission is to help file benefits, but you better believe they have a background and they have further resources and can help guide people and answer those questions. Because you're absolutely right, it's not a male or female issue per se. Once again, females are more likely to experience these things, but if surveys and studies have been done, and we're over 20% of men experience similar things in their lives, whether it's to the degree of simple sexual harassment or sexual violence. So it's important conversations to have, and the folks are out there to talk to. My old favorite is just Google too. We can all do that. We can all take a minute, step aside and plug it in the search engine. There is just a overwhelming amount of information out there that can help, get us all on the same page.
Is there anything else that you would like to add? Anything that I've missed?
Well, just the overarching thought that I think has been within our conversation and within the questions is we're all part of the same family. It means a tremendous amount to me to be part of the veteran community. And when I say brother and sister, that's what I mean. And I wouldn't treat my brother or my sister the way that sometimes we see people, whether at a VA medical center or an outreach event or something like that, the way some people are treated, or I would never do anything to make someone feel uncomfortable that I love and care about. And, we're all part of this big family, and it's important that we take it upon ourselves and we step up, and we're part of making a difference. And I do think we're headed in the right direction. And I think we have taken positive steps as a community, as a group of men and women that have served together in defense of our country. And that's a big deal. And I look forward to continuing to grow in this regard, and all of us stepping up and making a stand like we've done in the past.
Well, thank you so much, Cody. This is such an important topic. I appreciate you taking the time to talk about it today.
Thanks so much, Mary. It's a pleasure.
Always good to hear from Cody, and really a great thanks to all of our guests today. Ashley, this was another one of those episodes just full of important things for us to discuss. And I think, as we've learned here with the White Ribbon Initiative here with the VA, starting to discuss these things is a great beginning.
Yeah, I mean, we know that progress has been made. We're very glad to see VA drilling down and making a point to start hammering this message home from a leadership perspective down and across all the VA facilities. But we know that, of course, there is a lot of work to do.
If you want to keep up with the podcast, we invite you to do so. DAV.org/podcast. Once again, the home where you can get it anytime. Subscribe wherever you listen, including iTunes, Google Play, Spotify, Stitcher. Be sure to follow DAV on social media as well. You can like us on Facebook, follow us on Twitter and Instagram. And I'm really looking forward, Ashley. We're rounding out 2020 here. It's been a sort of a odd year to say the least, but we've got some really good podcasts ahead. In addition to some of the stuff we're going to get in our next episode 13 on veteran employment during COVID-19.
Yeah. So, I mean, two of the big topics that I think, you mentioned 2020 has been a heck of a year. Employment and suicide prevention, I think, are two areas where we really need to make sure that we're shifting some focus and having those discussions about what we can do to support veteran employment. and take a look, in this next upcoming episode, we're going to look at sort of the outlook for veteran-owned small businesses and what people can do maybe to help ease some of those burdens that have been falling on small business owners. And again, suicide prevention, it's been a topic for a number of years, but especially now during the pandemic, we've seen numbers are certainly not getting any better. And DAV actually has a new partnership with a nonprofit called Save a Warrior, which I'm very, very excited to talk about. We'll get more into that in episode 13. So please tune in. You definitely don't want to miss that one.
Thanks again for everyone for listening today. And be sure to check out DAV.org. Once again, if you're a veteran in need of help, you can learn about all of our services there. Find a national service officer closest to you. Our job fair, our virtual job fair, so much there that you can do. And if you want us to help veterans, you can also go there and donate. It's DAV.org. For Ashley Burns and all of us here at DAV, I'm Dan Klaskins. Thanks for listening to another edition of the DAV Podcast.